Good afternoon, everybody, and wish you happy Sunday. Today, I am going to explain you the diagnosis of epiploic appendigitis. So, first of all, we will learn the basic anatomy of what we call epiploic appendage. So, epiploic appendage is it is a small fat-filled pouch of visceral peritoneum that hang from tinea coli. So this white line, this is called tinea coli, and this polypoid yellowish color which is hanging, it is called epiploic appendage. So epiploic appendage, it is a normal structure that we see in the large colon. It is a fat filled pouch, and when this fat filled pouch it gets inflamed, it causes pain. So how to suspect whether uh, how to find out that this diagnosis of epiploic appendicitis. So here is the video. This here, you look carefully. This is the descending colon, and from the surface of this descending colon, there is some hypoechoic area over here. It is measuring around 8 by 6 mm. So it is quite logical that this kind of polypoid, these fat droplets, their size is something nearby 8 by 6 mm only. And second thing is, it is located in the periphery of this descending colon, and it is having somewhat connection with the surface of this descending colon. So this polypoid, some round to oval mass, it is homogeneous, uh, and this fat droplet structure, if we assume that if we cut this fat droplet, then this fat is also homogeneous. So this is this polypoid mass which is in periphery of this descending colon is called epiploic appendage, and when this mass it gets inflamed, uh, we say it that it is epiploic appendicitis. Now how to diagnose whether this mass is a normal mass or it is inflamed epiploic appendage? Normally, mild grade of this epiploic appendage we generally don't see, because it is very, not so common that we see this kind of epiploic appendage very frequently. But sometime when this epiploic appendage is inflamed, then it becomes little bit edematous and hypoechoic. And the basic fundamental of ultrasound says that whenever there is any soft tissue is inflamed, it becomes water lodge. The cellular component becomes uh, there is a water aggregation in the cell. So the more the water, the more it becomes hypoechoic. And in the simple cyst, we see that there is only water fluid, so it becomes anechoic. So this is the milder form of epiploic appendicitis, and when this fat globule it becomes more inflamed, then we see sometime internal cystic area collection inside this fat droplet, fat filled pouch, and surrounding what we say soft tissue inflammation also, fat stranding in the periphery of this epiploic appendage. So a very fine diagnosis, not so much important if you don't diagnose or you miss the diagnosis, but for giving the quality report and to find out what is the cause of the pain in the left iliac fossa, uh, it is very important that if you have this kind of micro knowledge, then you can give a better reporting, better diagnosis, and you can help the clinician to reach to its final diagnosis. Second thing is that whenever there is epiploic appendicitis, the patient generally don't have any positive findings in most of the cases in the increased WBC count or CRP or nothing. just very mild or moderate type of pain, but the pain is such that it sometimes lasts for a few months, and the patient is somewhat getting irritated or worried that if nothing is there in the report, then from where this pain is coming. And sometimes the pain, it is of higher severity also. So if you know this kind of, if you can find out, if you can scan this kind of findings, then it is worth that you can save the time, money of the patient, and the time of the physician also, to help him to reach the very this kind of small diagnoses which are not so much important on clinical point of view, but we can make aware and educate the person that about the right diagnosis. Okay, thank you.